This rhythm is normal sinus rhythm with premature atrial complexes. Premature atrial complexes are beats that originate from an ectopic site in the atria. Because these impulses do not start from the sinus node, the P waves look different from normal sinus P waves. Depending on the distance of the ectopic site from the AV node, the PR interval will be different from the PR interval from a sinus beat. Impulses from premature atrial complexes still stimulate the AV node normally, producing normal appearing narrow QRS complexes. PACs occur earlier than normal beats. Premature atrial complexes often reset the timing of the normal rhythm, and therefore there is a little pause after the PAC. Here you see a sinus beat, PQRST, followed by another sinus beat, PQRST, followed by an early abnormal-looking P wave, a premature atrial complex, and a normal QRS complex. This is followed by a short pause and then a normal sinus beat. This rhythm is atrial fibrillation. Atrial fibrillation is a rhythm that originates from many ectopic sites within the atria or upper chambers of the heart. In atrial fibrillation, the atrial impulses beat at a rate greater than 350 beats per minute, making the baseline of the ECG appear squiggly and chaotic. You will not see organized P waves, but occasionally P waves may look nearly normal. The atrial impulses bombard the atrioventricular node, but normally not all of these impulses can get through to the ventricles. In a normal heart, the ventricular rate is around 110 to 180 beats per minute. The ventricular rates vary depending on the health of the atrioventricular node and the medications the patient may be taking. Since the QRS complexes originate from the atrioventricular node, they appear narrow and normal looking. Here are the fibrillatory waves, and here are the QRS complexes. Thanks for watching this video. For more about ECGs and arrhythmias, take a look at our full catalog of courses.